Okay, all right, so let's review how to load the cassette and prime the tubing. So I've opened the the bag here, which we're gonna pretend is like medication, okay? And then this is the CADD tubing. So I'm just gonna come around. So I'm kind of doing things upside down, but I will try my best. So basically, we know that the pump is still on, right? Because the amber light's flashing. The screen is just saving battery power, so it's dark. So let's first get our bag organized. Okay, so here's the tubing here for the CADD pump. Stays together with that. This is your cassette, okay? Which will go into the bottom of the pump. This blue thing is just a protective piece. Well, it's in the packaging, but we don't need it. This is garbage, okay? So I'm just gonna go through, make sure I'm all untangled here. I don't have any kinks or anything like that. I've got my filter intact, and then I'm going to make sure that I've clamped this, okay? One way to prevent like air in line alarms is to definitely like to clamp the tubing before you spike and prime a bag. So making sure you're keeping this from touching anything, because this is sterile, as is this. If I can open it, hold on. There we go. Okay, so I'm just gonna point this sharp bevel up and spike my bag. Sometimes I twist it a little bit so I make sure that it's right up there. Okay, so I spiked the bag. See, I don't know, you probably can't see from there, but this has a little air bubble just from where I spiked. Sometimes I'll just squeeze that a bit. There. Okay. Just get out that one last bubble so that we can, like, when we prime the pump, we're kind of like making sure we don't get air bubbles. I would also prefer that this be kind of hanging up so we can prevent more bubbles, but for the sake of this demonstration, it's gonna be just lying flat. Okay, so now we want to insert the cassette into the CADD pump. Okay, so let's get the screen back on. Okay, so to do that, I have to open the latch. Okay, if it's locked, you might have to have the narcotic key to open it. But for now, we can open the latch, and then we're gonna take the tube. So there's two little hooks here that will line up with these two little hooky-doos here. Okay, so I'm gonna line those up and I'm gonna press, and I heard a click, okay? I hope you did too. Secondly, I'm gonna put it on a flat surface and push down just a little bit to make sure it's really in there. And then I'm gonna put my latch back up, okay? So another way to ensure that you have it in the right space is just like even looking and visually inspecting the bottom to make sure it's not like all wonky. I mean, it probably wouldn't work anyway, but it's just a good thing to check. So now it says prime tubing, question mark. Okay, so right now we are gonna say, yes, we want to prime tubing. Okay, so first I need to do this. I wanna make sure I'm not, that it's not clamped anymore so I can prime it. Secondly, I want to find my end and my filter. So I'm gonna be holding the filter, like, see there's an arrow there? I'm going to be holding the filter pointing up. This is hopefully going to catch some air bubbles as well. My advice is to kind of give it a couple flicks as the fluid goes through. Another tip that I've heard recently is putting the pump on its side while priming it can help reduce the risk of air bubbles. I'm not sure if that's true or not, but I've heard it as a trick. Another trick I heard, if you are getting air in the line alarms, is stopping the pump and looking at this and then seeing if you can sort of just tap along here to get any bubbles out. So that's another, you know, trick of the trade, I guess, because those alarms can be pretty annoying. Okay, so prime tubing, yes. Oh, it's gonna make me enter the code. Okay, 1 sec. Okay, and now look at this warning. I love this. Disconnect tubing from patient. Open clamps and then press prime. So it basically tells you exactly what to do. You would never prime a line when it's still connected to a person, because this is just full of air, right? You do not want to inject any air into someone. That's very dangerous. Okay, so let's press prime. And now you'll see it's counting down an amount primed. And with this a set, it's usually about 16.8 or something like that, 16 milliliters. So again, I'm holding my filter facing up, and then I'm just waiting for my fluid to come through. You can see it coming already. And there's some bubbles here, but they're gonna get caught once they hit my filter, so I'm not too worried. And it does feel like it takes a little while, but this is long tubing. Once I start seeing the medicine or the fluid coming out the end here, I'm gonna press stop priming. But we're not there yet. Oh man, look at all these bubbles. We will get you. And so I see it approaching the filter here. And now it'll slow down a bit, you'll see, as it fills up. I like to give it a little tap. And then once it comes out, you'll see there's no more bubbles. And we're almost there. So what are we at? 15. Okay, let's see if I was good, if I made a good guess. Okay, stop. Okay, perfect. So it's in, I can see it in there. So it's been primed the whole way. Oh, 17. Okay, I was thinking 16.8. So I stopped priming because it's done. And it's gonna ask me, continue priming, yes or no? Well, I'm done, so I'm gonna say no. What I want you to notice here as well is that right here it says 83 milliliters. So whatever we've primed in here, which is 17, has taken away from the volume, that the reservoir volume that was set originally, which was 100 milliliters. Okay, so let's see if I can come show you a bit closer. Oops. Whoop, there. Oh, I hope you can see stuff. Anyway, okay. So it says review pump settings. Okay, so let's review continuous 200 mils per hour, and then we have to accept. Yes, no TKVO rate, that's fine, it's 0, accept. And then our reservoir volume, is it 100? Let's for the sake of the demonstration say yes, it's still 100. That's how much we want to go in. Okay, so now it's gonna ask me, do I wanna start the pump? Yes or no? Well, if you look right now, I am not attached to anybody. So let's review that first, and then we will start the pump. Okay, so I'm gonna, hi, can you just, I'm Katie, I'm your nurse today. We have to start your medication. It's gonna go into your IV today. Can you just confirm your name and date of birth for me? Yes, I'm Robert Smith, November 12th, 1968. Oh, great. Thank you, Robert. So I've washed my hands. I've done my 2 patient identifiers, and then I'm gonna assess my IV because that's where this medication is gonna go. So he's got a 20 gauge IV. I look at the date, it was just done this morning, so that's cool. It looks great. There's no redness or swelling. When I palpate it or when I ask the patient, they say it's not tender, they don't have any pain there. And then what we're gonna do is just flush it. So before we start the medication with an IV and with a PICC line, we're gonna flush them first to make sure that they're patent. So for an IV, it's a little bit easier. So we're going to just wipe one of these. We're not gonna use both, so wipe that. And we're gonna wait for that to dry. I'm also gonna unclamp it because I have to flush it, okay? My advice is to keep this little cap if you can for later, because, or this cap, because once you attach them, or once you attach them, you're going to want to cover this end again to keep it aseptic. But anyway, that's up to you how you do that, but I've got some little tricks. So okay, so I've wiped this, and I've waited for the alcohol to dry, or in this case the chlorhexidine swab, and now I'm just going to push my fluid in. Let's say I pushed it much faster than that, just about like, you know, 2 or 3 milliliters. It doesn't have to be the push pause technique, okay? This is just an IV. You don't have to draw back to see if there's blood. I just want you to flush it. So when you're flushing it, you're observing like if there's any infiltration, any pain, that sort of thing, okay? So that was great. It didn't hurt. Are you all good, Mr. Smith, if I start your antibiotics? Yes, I'm fine. But okay, cool. All right, so now I'm going to attach my medication to my IV. He is still clamped off. This is not clamped, so I'm gonna just make sure that's unclamped. So now everything's unclamped. Bring our screen back by selecting any button. I often press select, but it doesn't really matter. Okay, so now start pump, yes or no. So yes, we're ready. Now you'll see the infusion is starting and the green thing shows up, and you'll see it's green across the top as well. Counting down my reservoir volume as it infuses, and the green thing here says it's running. Don't know if you can see that. And now you're done. So I'm not gonna leak this all over the whole table. So what I've done is I pressed start, stop to stop the pump. It is still running, if you can hear that. And it's asking me, stop pump, yes or no? Well, yes. Okay, and now you'll see the red hand there again. Stop is pumping. Pump is stopping. And you'll see my reservoir volume has declined as it was infusing. The red hand there says stopped. Okay. So that's pretty much it for, you know, priming the line and getting the medication started. Now, for the case of so instead of an IV, let's say Mr. Smith has a PICC line. In that case, before you start the infusion, you're going to check the patency of the PICC line. So with that, you would have, this would be sterile, obviously, and then you would draw back to make sure you're getting blood return from the PICC. And okay, yes, I got blood return. I'm gonna do the push pause technique and flush this through the PICC line. That's 10 mils. I'm gonna take a second one, and I'm not gonna draw blood this time. I'm just gonna keep continuing flushing. So flush the rest of the 10. So push pause, push pause, push pause, and then clamp as I'm finishing it off. This helps create turbulence in the, you know, the tubing, and hopefully like will prevent, you know, buildup and debris, because we don't want to have clots. So that's what we hope for. So I'm going to with my PICC line, I'm going to draw back for blood. I'm going to flush with 20 cc's, and then I'm going to start my infusion. And with again, with the same thing, with the PICC line, the IV subQ doesn't matter. You are assessing the site first, okay, as well. Making sure it's not painful, it's not red, there's no signs of infection or infiltration, anything like that. We're gonna get to the subQ port next when we go through the PCA stuff. But let's just disconnect this. So Mr. Smith has finished his antibiotics, and he's due again in 6 hours. So I want to keep this tubing because we don't need to change the tubing yet. We change the tubing every 24 hours, but you know, unless otherwise stated. So next time we have his antibiotic in 6 hours, we'll just change the bag. So it stopped, okay? My patient is, IV is clamped, and I'm just gonna disconnect that. And I saved this from earlier and kept it sterile so I can reuse that. And with the IV, I don't need to flush it, okay? It's fine. If it was a PICC line, I would flush it again. This time, I wouldn't necessarily draw back for blood. You can, but you just used it, so it's fine to just flush with 20 cc's again. So 2 of those syringes, and using the push-pause technique as usual. And then let's say, oh, you know what? His infection isn't sensitive to this cloxacillin that we're giving him. So we're gonna get a new medication. So we actually have to disconnect this. So, okay. So, okay, we're not gonna use this. We're gonna have to get something else. So we're gonna take the cassette out, and we're just gonna open the latch and then take the cassette out and close the latch, okay? So that was easy. And if it was narcotic, you'd have to be using the key. And if you had leftover narcotic from a PCA pump, you're going to be reaching out to John, myself, or the charge nurse what to do next, okay? In terms of wasting that. Okay, so now we're done with this. So we're going to press the power button on the side. And it says power down, yes or no? Yes. So after we're finished with using this, the client says, I don't want anything else. You know, take out my IV. I don't want anything else. So we're gonna send this back to Bayshore. Please just use like, sorry, I don't have one here, but a Virox wipe to wipe this down, and then remove the batteries, and then we'll give it back to the charge nurse or whomever in like the bag that it came in, and then we can just give it back to Bayshore like that. But it can be wiped with the Virox, and I would suggest taking the batteries out when we're gonna give it back, because they're always very sensitive to those things. Okay, thanks.